Hello and welcome to the program. I am DEJI Badimosi. Now, the dreaded coronavirus has finally hit Nigeria in the face as confirmed cases in the country has, I would say, is now beginning to surge. After a second confirmed case of a Nigerian who had contact with the index case returned negative, the Lagos State government announced a third case of another Nigerian, a 30-year-old lady who recently returned from the United Kingdom. Now, shortly after that announcement, the Minister of Health, Dr. Osagie Ehanire, confirmed 5 new cases. In addition to that, the Lagos State Commissioner for Health, Professor Akin Abayomi, again confirmed 4 new cases of the COVID-19 pandemic in Lagos, one of which was a man who had no travel history at all, suggesting Nigeria's first case of community transmission. As Africa continues to brace up and prepare for what the World Health Organization has predicted could be a worse situation, preventive measures have already been taken or put in place, I should say, across Nigeria. State governments are now beginning to restrict public gatherings beyond 50 persons. Schools have been ordered shut down nationwide, and everyone has been advised to practice social distancing, of course, hand washing. Nigeria has also restricted flights from 15 countries considered to be high-burden countries for COVID-19. A sense of panic is beginning to build up across the country, and if the situation gets worse, we cannot rule out the possibility of a total lockdown like we have seen in Italy and we saw in China. With no vaccine yet for the virus, prevention still remains the key to fighting COVID-19. Joining me now to discuss more on the preventive measures are Dr. Owolabi Adeola and Dr. Jeje Olugbenga. Both men are community health physicians at the Lagos State University Teaching Hospital, LASUT. Gentlemen, thank you very much for coming on the program. Let me start with you, Dr. Owolabi. Just how serious do you think this is?
Yeah, I would say this is really serious, considering the time when it started, 31st of December till now. Initially,
not showing any sign of slowing down.
It's not showing any sign of slowing down. And initially, it was declared as a public health emergency of international concern. Now it's been said to be a pandemic. So we are really in for it. It's a real serious case we have at our hand.
Dr. Olugbenga, are you surprised that, we are now in the situation we found ourselves? Because at some point, some people thought this was not going to get to Nigeria.
Really? Something that we've emphasized as public health physicians. And from day one, we've been proactive. In fact, WHO really at a point, they are praising Nigeria that we're really doing a good job. Because it's something that is pandemic. And pandemic means that it's across all continents of the world. So from day one, we have been proactive here in Nigeria. We've had colleagues at the airport screening passengers, taking information manifest of people coming in. Fine, initially we had just a case, which we were able to track. But as cases were soaring around the world, we expect a spillover. And that's what we're experiencing now. So with the spillover happening now, we've also upped our game. And as you have earlier pointed out, we have started taking measures now to make sure we are trying to raise alert levels. Alert levels are being raised. When it started December, January, we see our gatherings and the likes. But now you have seen the current trend now. We stopped gatherings beyond 50 people, and then we are closing down schools now. So we are raising alert levels and making sure that we must contain this virus.
Now, you're quite right. The first case, the index case, the Italian. Now, we had these other cases, and today we have 12 cases in Nigeria. Would you say it was some kind of failure on our part at the port of entry?
No. I wouldn't say that. It's not a failure at all. It's not a failure. Just like anything pandemic and variant origin, you expect things like that. What we do is that we try to contain it. Fine, we might have some little spikes here and there, but once we're able to try and reduce the number of cases. You saw what happened in Italy. They must have tried to contain it, but there was a day that they had...
It's terrible in Italy.
Yes. There was a time they had serious spike in cases. It went up and then people were scared. Initially it was China. But so today now, Italy has more cases than China. And it sounds absurd, but then, so for Nigerians, we're really trying. Now we have community transmission. That's the new thing now, why we're a little bit scared and raising alert levels. And that is why we're trying to, okay, schools, you have to close down now. We started here from Lagos, and the federal government has even picked it up now. I said all the stations, all unity schools, they have to close up. The NYC orientation camp has been stopped immediately because we have foreign students coming in. And even we have flights cancelled now. There are no longer flights from those countries that have more than 1,000 cases. So that shows we are also raising our levels of alertness. And that is what we must keep on doing to at least prevent further transmission.
Let's talk about this community transmission. That is very worrying because this individual, no travel history at all. Just how serious is the issue of community transmission? Because it's quite scary to hear, to know that we could have a case of community transmission here.
Yes. From what we know about this virus, it is transmitted from persons to persons. But my concern is Nigerians are not given the necessary information. We've heard of people who have traveled and they are not given the history of their travel history. And you know, we are social human beings in this country. We like parties, we like gathering in numbers. So this exposes others to the risk of getting infected. But what's the measure that has been put in place now is contact tracing, which the NCDC, the Federal Ministry of Health, the Lagos State Ministry of Health is the active tool they are using right now to trace all the contacts. And another thing I noticed...
How difficult is this contact tracing? Because, for instance, the Lagos State government and, of course, the federal government has announced that for the 4 new cases we saw, and maybe by the time this program goes to air, the number might have gone up, that for the 4 new cases we saw, that they're now trying to track about 1,300
persons. You know, there is something you call line tracing. That means the immediate contact with the person. You start from the family, you understand, then history of where the person has been to. You understand?
You need to get
every other thing. I was discussing with someone yesterday that technology could actually help in doing this, because if your location is on at a time, you understand?
As we are seeing in Israel,
yes. The number of people who were there at that particular time, you can actually get the history from the mobile phone and try to contact them. So we need to explore and use every means we have at our hand to really help us in tracing and tracking all these people.
Dr. Olugbega, why is it important to trace and track these people who may have come in contact with an individual who has a confirmed case?
You see, the issue of the transmission is like a cascade, like a chain reaction. When this gets to this can transmit to this. It's like an A to a B to a C. So the moment maybe you have an A, an index case, and you have a B, and you're able to track that, and you're able to get those people
so you break the chain.
Yeah, the chain. Either into quarantine or isolation, whatever it requires. So once you're able to achieve that, you can stop that transmission. And as they say, ignorance is death. Most people in our country now are ignorant of even this condition. Some are saying it's something phantom, it's propaganda, it's not true. So now we must get them educated that this thing is true and it is with us. So that if they even have that insight that, okay, fine, this thing is real, then they can then report. Because we can't track all the cases. It's quite difficult. I think 1,300 cases now. My colleagues at the airport at the time, they said, when they asked them for information, I said, okay, what if I give you a fake address? They still take it with levity as if it's nothing extraordinary. So education is very important. If they are well educated and they then know that, okay, this thing is with us, then it makes the contact tracing easier and the community transmission can be aborted. So if we can have people knowing that, oh, this thing is with us, so I have these symptoms, and they come around, they show up, it makes the work of the community physicians even easier. Because instead of trying to look from house to house, door to door, do you have this symptom, do you have this, do you have that? If they can come out and say, sorry, I just came back from United States. I came back from UK. Or I have a neighbor that just came in and had contact with him. I'm a driver, Uber driver. I drove this guy, and I have these symptoms now. It makes it easier for us, and we can then stop the transmission. So what?
I'm just wondering, how difficult is it for you guys who are doctors now? Because as community health physicians, you deal with patients on a daily basis. So what happens now if people come to you presenting with some of the symptoms? And some of the symptoms may not be, they may not be COVID-19. Naturally, people would have cough, flu, and what have you. So how do you deal with patients now?
Okay. It's just called triaging. How do you triage them? Now, as you have said, the symptoms are like flu. They're flu-like symptoms. So, but some are still peculiar. Now, if we ask for a travel history or contact with someone that just came in.
So does it mean any patient who comes to you at this time, the first thing you do, you begin to ask some of those questions?
The first thing we do is to check the temperature. Once you have an elevated temperature that is persistent.
That's a red flag.
Yes. You have to refer that such a patient.
And then you withdraw a bit.
Not necessarily withdraw.
Okay.
It's a calling. Medicine's a calling. Like it's you're on the line of duty, and you must stop this. We've had some doctors losing their lives, unfortunately, but then it's a calling. We are supposed to dare to at least. I'm in a real situation. So when they come in and say, okay, we have elevated body temperature, have a running nose, they are sneezing with cough, it gives you a red flag. And then you further questions, and the person says, oh, I've had contact with so-and-so person. Then begin to say, this might be COVID-19. So those are just the ways. Some might just come with just regular cough and the likes, and then you see. You had the case of natural state.
Yes, exactly.
Yes.
The family of 5.
The family of 5. The same day said about 4 of them no longer having temperature spikes. Just a child of less than 7 years old or thereabouts. That's the only one that has the symptoms. So what we do now that we try to say, okay, even with that, they've taken all their samples. Taking the samples, if you check and it comes out negative, okay, fine. But it's better to err on the side of caution. It's better we check you and we see that this person is actually negative than to just assume, oh, it's just common flu or common cold. We won't take that risk.
As a doctor, are you really scared that you're at risk? Because you deal with patients on a daily basis.
Yeah, for a doctor, this an occupational hazard, you understand. But measures have been put in place for us, and there is international safety precautions that are expected.
Have you guys been provided training, for instance, in the handling of COVID-19 cases?
Yes. Initially, that was around February when we had our grand round in the hospital. Doctors, nurses, and all health personnel and staffs of the hospital were trained on how to observe all these safety measures, and instruments were put in place, equipment were put in place to also help. If you go around the hospital now, you see buckets of water, hand sanitizer being provided around the hospital for even patients to use. So as a doctor, I'm not really scared for myself because I know what to do to prevent it. So, and I'll observe all those things.
All right, let's just quickly take a short break. When we come back, I want to find out from you how exactly, with no vaccine now, how are people with COVID-19, how are they being treated? We'll take a short break and we'll be right back.
But there's criteria to be tested because these testing kits are scarce, they're expensive, and we are not going to expend it on anybody who comes and say, test me. That will not work because no country can afford that. There's one country that wanted to test everybody, and very soon they discovered they had to abandon the idea. It's not possible because they collected samples from everybody and sent them to the main laboratory, and very soon their test kits were gone and they didn't get. But you see, you must fit certain criteria. First is that you must have been outside the country within the preceding 14 days or even if it's 16 days, we'll accept. If you haven't been, then you are not eligible. Second is that you may have been in contact with somebody who has been in close contact with somebody who has traveled within the preceding 14 days, and that person either has been tested or has not been tested or has tested and is positive. If you fit those criteria, yes, definitely you'll be invited to test. Otherwise, you have to stay in self-isolation. If you have traveled and you have no symptoms, and keep reporting. Immediately you have a symptom, you can call and say, I traveled within the last 2 weeks and just came from abroad and I'm not feeling well and I'm feeling very sick, I have fever. Then immediately you will be given attention for testing.
Welcome back, and if you've just joined us, we're discussing COVID-19, of course, in Nigeria, and I have two medical doctors with me. Dr. Olugunga, with no vaccine, how then are people with COVID-19, how can they be treated?
COVID-19
because, of course, I mean, let's face it, people are recovering from this.
Yes.
People are being treated and recovering, and we understand well the symptoms. What they do is you treat the symptoms and all of that. But could you enlighten us more? And that people really need to also understand that it's not as if you catch COVID-19, you are dead.
No, it's a viral infection. And most viral infection, the immune system will fight it. So what we do is it's two-pronged, it's twofold. One, we try to raise the immune system of the person by giving fluids, then symptomatic relief. Person has a fever, you want to bring down the fever. Person has a cough, you want to relieve the cough. So while you are bringing the symptoms down...
The person has pneumonia, as we're seeing in Italy.
Yes. With pneumonia, normal treatment of pneumonia, antibiotics and the likes, fluid. So, but the first thing is that we raise the immune system because it's a viral infection. And anything viral affects the immune system. So once the immune system is strong, the soldiers of the body are strong enough to say, oh, use this virus.
Could that be the reason why they say younger people have more capacity to fight it than older people?
At the extremes of age, the elderly and the young, the very young, they are susceptible because the immune system is not, for the young, is not that developed. For the elderly, it's weak. So they have tendency to die more than the middle age. So, like I said earlier, it's just a function of the immune system. Once the system is strong enough to fight the virus, the person recovers. So basically what we do is to make sure that we raise the immune system, hydrate, give plenty of fluid. Fluids can be taken orally and intravenously. On admission intravenously, pass it through the veins, goes to the bloodstream directly. For those that are not symptomatic, you can place on oral fluids. Some are taking liberal fluid intake, plenty of water, helps a lot. So even as part of preventive measures now, we are counseling people take plenty of water at this period.
So other than washing of hands,
yes,
social distancing,
even
using
taking
hand sanitizer.
Yes, plenty. Call it liberal fluid intake. You know that most of us take water only when we need water.
That
okay,
is true.
I'm thirsty.
That is true.
Let me go and take. But now it's not issue. Just take water. The average water intake a day should be 3 liters. But now, let's increase it. So when you are well hydrated, plenty of fluid intake, the person has a better chance of avoiding the infection.
We continue to hear, I mean, there was this misinformation all over that the U.S. had approved the use of chloroquine. Of course, the FDA in the United States came out to deny that it hasn't given that approval and all of that. Chloroquine, we know, to some of us, chloroquine, and to some people, it's actually a very dangerous drug when you consider some of the side effects and all of that. And some people are actually allergic to it. Are you surprised that people are talking about chloroquine now? And the misinformation is spreading.
Yes, people are bound to come up with different things when we have cases like this in our hand. Like chloroquine is actually used to treat malaria, which is a parasitic infection, and there are process and procedures you go through.
Because now we're beginning to see some people on the basis of that fake news, they just go to buy chloroquine over the counter, and and just they want to take...
It's not a verified information. Before you declare, our own NAFDAC, which is equivalent of the FDA, would have subjected it to clinical trials and see the efficacy in this respect. You understand? But none of this has been done. It's just like coming out to say, I have a cure for AIDS. You understand? Without going through the scientific process of how to present it to the public and testing it to see that it's not dangerous for the public. So now chloroquine, as far as I know, it's been used to treat malaria in time past. There has been resistance and with the side effects to it, it is no longer being used. You understand? So these are just rumors flying around just to allay fear by the public. Yeah.
Are you surprised that this issue of chloroquine is suddenly coming up? And is chloroquine a drug people should just go buy off the counter and begin to take?
You don't even buy a drug over the counter. Ideally. All drugs should be sold if you have prescription. But you know, this is Nigeria, this is Africa. People, during the Ebola incidents, we heard so many stories, using salt and the likes. So when these things happen, someone will come up with one theorem or the other. Fine, the chloroquine stuff went really viral, if I can use the word.
Exactly.
But there is no scientific basis for that. Chloroquine is a drug used to treat malaria, which is a parasitic infection. And we know how it works. For a viral infection, like the COVID-19, there is no scientific basis for the use of chloroquine. So, for now, I don't know what maybe the next future, or maybe they will have found something, or maybe combine chloroquine with something, maybe with antiviral agents, maybe. But for now, there's nothing like that.
And if you were speaking to people out there who are watching now, what exactly would you tell them about the use of chloroquine? Because whether we like it or not, some people are believing that story and going to buy chloroquine.
I would just tell them to just forget about it. What we do is preventive medicine here. Let's prevent the spread. Regular hand washing, social distancing, and if you feel any symptoms, report. I think if you can follow those basic principles, we are home and dry. Once we can stop the transmission, curtail the spread, we are good to go.
Finally, let me ask you this. Do you think this will get worse before it gets better? Do you think we'll get to a situation where there might be a lockdown, total lockdown, for instance, in Lagos?
I pray we don't get to that stage. Like the state China is in now, the number of new cases being reported is gradually reducing. Yes. So with the effort being put by the state governments, by the NCDC, I don't see us getting to that stage if people will comply. You understand? Compliance. And if people are really truthful, you understand? If you suspect that someone has it, it's not a death sentence like we said earlier on. So if we need to come together so we won't get to that stage. Help the health workers, help the government, you understand? With the measures being put in place now, I don't see us getting to that stage.
And what would be your final word?
Prevention is the key. Let's just prevent the spread. Maintain personal hygiene, environmental hygiene. Let's make sure we wash our hands. Wash our hands always. Wash our hands regularly. Social distancing for now. Let's avoid parties. I know there are religious people in this country, clubbing, cinemas, and like. And most importantly, religious activities. This country, we play religion over everything. So I have to say, over common sense. So what I would just implore people to do is, please, for now, let's just comply. Once we can comply with simple rules, we are good to go.
All right, gentlemen, thank you very much for coming on the program. Sure. And for those of you who are actually on the front line, we pray God continues to give you the strength to help us combat this. We'll take a short break and we'll be right back. On DEJI 360, we don't just ask the questions. What is wrong with amending the Constitution the way the National Assembly members have been doing it? We seek answers.
Constitution is constituent. Our problem is not lack of laws. Our problem is lack of the willpower to implement our laws.
Answers that provide clarity.
While we negotiate, we should try to make it a point that the girls must be complete.
The clarity you need to make informed judgment so that you can make the right decision and take action. People are saying it is you politicians that are responsible for this, that you are the reason why this is happening.
All these dollars that call themselves governors in this country.
I wish we had people like Tony at the National Assembly.
God forbid that I go to join that panel.
DEJI 360, providing clarity to issues. All right, welcome back. Let's continue this discussion on COVID-19 that is currently ravaging the world now, and of course, Nigeria not been left out. I'm now being joined on the program by Dr. Tuyu Mebawandu, who joins us from another part of Lagos. He's a public health physician. Doctor, thank you very much for joining us on the program. Let's talk about the preventive measures, because as we speak, there's no vaccine at all for COVID-19, but talk about the preventive measures. Now, what do you think can make the difference for Nigeria in the fight against this virus?
Thank you, DEJI. So sad that we lost the initial momentum and we're at this stage now. Now, we must see this thing as a very, very important and emergency situation as it is. Of course, the standard is that we have to act at individual level, we have to act at community level, and then the government must be ready to also provide that enabling environment for those activities to be meaningful. Of course, at our individual level, we have to still push sanitation and hygiene. We have no choice than to maintain social distance. And then, in addition, anyone that is feeling sick must be able to have a way to meet and talk with the health people. So we must be able to act at the level of community and to interact with ourselves and ensure that we provide support and assistance when necessary. Now, if government still say that you should not gather more than 50 people, and I don't know the rationale for that 50 people, we must ensure that we comply with it. 50 to me is still a large number. We need to minimize it to less than 10. What are you gathering for when you have this kind of emergency on our hands? Now, the provision and the guideline for us to maintain social distance must be clearly spelled out by government, must be supported, and also supervised. So government needs to aim up and really, stand up to ensure that the conducive environment for these things to happen, are maintained. There must be a quick response to people, to any complaint, to people that want to get information, to people that are having suspected cases of coronavirus. There must be the response. At the level of every government, I'm talking about every state government, we must be able to set up a quarantine system. We must be able to set up a support system, because what we are seeing is evolution of this thing into economic challenges. It's an economic war, it's a health war.
Sorry to interject. Don't you think it's also necessary to have these laboratories that have the capacities now to test for COVID-19 in various states of the country? If you do not have it in various states, at least in just across the entire 6 geopolitical zones.
Yeah, you see, part of the government's preparation is that ability to get people tested. It's already challenged severely because, one, the kits are not that available. We don't want Nigeria's situation to be such a full-blown crisis. If it comes to that, we'll be hampered in terms of testing. The test kits, the laboratory support system, for now we're just having about 5 laboratories in the whole of the country, which is quite minimal. So now what we need to do is to enhance laboratory capacity both in private and government level to be able to do these tests. It is very important. Now, we must be able to train quick people now, because I expect government to have been doing a lot of training for the laboratory people, for medical people, for the support system, so that, should we now need to utilize them in a more aggressive manner, we can have people that can be used.
Now, how important is the issue of information dissemination, enlightenment campaign now in the fight, Nigeria's fight against this disease?
That's the most important instrument you have. Enlightenment campaign is the most important instrument before us. Because, wait a minute, we're having a weakened health system. We cannot be able to deploy tests as we should do it. We don't have the isolation center, or quarantine places that can take charge of a large number of people. And we know that this number can double within a short period. It can triple and quadruple within a short period. So what we need to do is, like, as we're closing schools, as we're preventing people from going to churches, we have to strengthen campaigns in different languages. It must be as local as possible. I expect the local government people to be on the streets, ringing bell, directing people, telling them what to do, and also, if it's possible, for them to install hand-washing instrument or capability in some key public places that people can just easily get there,
that's
put water in their hand and wash,
level too,
and move forward and pick leaflets if they need to read about it. So for us, the cheapest and the most effective thing we could have now is to deepen that sort of campaign.
We've seen situations where, look, whereas it appears there's some kind of, I don't know how to put it now, some high level of awareness in urban centers. In rural areas, rural communities, you don't have that level of awareness. How do we deal with that?
Now, I think if we localize this thing at the level of local government, it gets to the local area as much as possible. I know that, because if you are going to deal with the local people, you need to speak their language. You need to be able to demonstrate these things to them. They need to know. You need to involve the traditional rulers. You need to involve the opinion leaders in those local areas and let them understand the challenges we're facing and why, everybody must be on standby to ensure that this thing does not go beyond this. Because if it goes beyond this, the social unrest will come in. You may see riots, because Nigeria, it's difficult for you to quarantine Nigeria and tell them that stay away from your work for the next 30 days. What are they going to eat, or for the next 20 days? What are they going to eat? So, if we don't do this thing appropriately now, we may face a lot of challenge. So, at the level of local government, I expect that every local government headquarters should be an epicenter of campaign, dissemination of information to assure, compliance with stated rules that has to do with prevention of crowd or gathering of more than 50 people. I expect that the number should be lower. 15 is still a large number by any standard.
Finally, there's a question I just have to ask you. The issue of chloroquine that is generating, it's sort of gone viral now on social media. I mean, people quoting President Trump of the United States of America saying chloroquine is a cure, even though the FDA of that country has come out to debunk that and said, what they're actually doing with chloroquine is to run a trial. But here in Nigeria, we're beginning to see cases of people going to buy chloroquine over the counter. How dangerous is that?
Indeed, very dangerous. And this is what we're saying. We cannot lose the dynamic of the discussion, the dynamics of the information in this very essential pandemic we're facing. Now, if Donald Trump, that is not a medical doctor, can then come up and be prescribing chloroquine, and then the thing is picked up in Nigeria, people are now buying chloroquine, you see chloroquine toxicity. People will use the chloroquine indiscriminately, even when they are not falling sick. Now, I will repeat that we should allow the health experts to prescribe and write that whatever you need to treat your sickness. Let's not forget that not every cough, not every sneezing, not every catarrh is coronavirus. Before the advent of COVID-19, people have been having catarrh, cough, and cold. So please, let us appreciate that. If people are buying chloroquine indiscriminately, we must find a way to stop it. And one of the ways we can stop it is to ensure that any pharmacy should not sell chloroquine for anybody without prescription.
All right. Doc, thank you very much for your time. Let's just hope things don't get worse. I just have to ask you this, even though I should let you go. I mean, the issue of community transmission now appears to have come to Nigeria because, I mean, there's a case of an individual now who has no travel history at all, has never traveled out of the country, as we've been told by the Lagos state government.
Oh.
And that individual has COVID-19. I mean, it's been confirmed. That must be something
transmission.
Yes.
Now, let me tell you, why Africa is not having such a large number of people with COVID-19. Look at it. This disease is a disease of globalization. Wherever you have a lot of tourists, a lot of movement, you tend to see higher numbers. Now, if you look at Nigeria, for instance, the number of people coming to our airports in a year may not be up to the number of people entering Shanghai airport in a week. So, the likelihood of us getting the thing is a bit lower. But the challenge we have is that with weak health system and with laxity in screening, we may then be faced with transmission and challenges of tracing contacts. So for us, for every case we see, we should look for another 100 or 200 or 300 contacts.
That's serious.
And the only way we can do it is to ensure that even at the level of village, if somebody is just coming to the country for a time or coming to your village for the first time, or is having cough, catarrh, and these things, the village must be empowered to report, to talk to somebody so that they can check appropriately.
Even our villages are no longer safe anyway.
For sure, because the villages feed the city and the city feed the village. There's continuous movement of people in between the two.
Yeah. Dr. Meba, thank you very much for your time and thank you for joining us on the program. Well, that's it on the program, but if you want to watch it again, it's very simple. Just go to our website, TV360Nigeria.com. You'll find this program and lots more there. You can also join the conversation on our various social media platforms. So thank you very much for watching. I'll see you again next week.